Well, thank you again for joining us. We're kind of equal almost, presenters and our audience, but it's really been a blessing. We've had kind of a collective parish nursing experience here of over 20 to 25 years, within our parishes. And we are the branches to Marian Advocates. She's our tree. We've really been following in her footsteps. So she's really been a blessing to share her expertise and then for us to follow through with what she's been doing. So parish nursing is basically setting up a community-based practice within your parish. And we start simply. We started with blood pressure clinics, and each church has their own personality. So our church in Saco, Maine has a more elderly population. So we've been developing programs along the elderly line. But then each month we have a newsletter that goes out. So I usually put a little blurb in there about some health-related information or education. And once a month we have a senior luncheon where we have 40 to 50 people come, and then we usually have a speaker of some type of pertinent information for the elders. But I wanted to share with you this prayer before we really get started. This is from Florence Nightingale, which is one of our founders in terms of our nursing education. The nurse must always be kind and sympathetic, but never emotional. The patient must find a real, not forced or put on center of calmness to his nurse. So this is kind of a little litany. Again, we ask, dear Lord, in the foundation of our Judeo-Christian heritage, you share with us your love that we might love in the selfless way you love us. To call upon a patient by emotion, for emotion is the most cruel, useless demand upon his strength. It is asking him to bear your troubles and your anxiety as well as his own. Suppressed emotions is as bad. It makes the nurse constrained. It is exposing the patient to both frost and fire. Dear Father, with your love and strength, may we always be able to intellectualize our professionalism. We are human, but help us maintain our integrity. We are drawn daily, hourly into the very core of people's lives, their fears, wants, pain, pleasures, families, friends. Help us to maximize their wellness while we tend to their illness. Half the battle of nursing is to relieve your sick from having to think for themselves at all, least of all for their own nursing. Dear God, we are truly at a crossroad in nursing. We have been taught and have an education developed with the patient's needs foremost. But now we are asked to be businesswomen, to be concerned about financial matters and third-party billing and discharging people quicker, sicker. Further, you have given us a solid foundation through our education to strive for excellence, to build bridges for the future. Please now give us strength to counter these trends, to keep the tenets of the Nightingale philosophy, that the very word of nurse is to minister to the sick. So that's why I think parish nursing can be really critical in our day and age for, all the questions with Obamacare, even though it has covered 11 million more people. There are a lot of issues that people question, and by having health care within your faith-based community, I think is essential. And I think we have, I tell people, we have plumbers in the church, we have teachers, carpenters. Why not your medical community? Address them and access them. So that's what we're trying to do little by little with our parish nursing. So this last year we developed this website that's kind of a work in progress, so to speak. So we have, this is our Holy Mother that kind of covers us all. And actually last night I was at Agia Skepa, which is this holy mirror-bearing icon it was at Andover, Mass. From Taylor, Pennsylvania. And it's really through our spirituality, that we address our needs and the needs of our parishes. So that's why we wanted to put our Holy Mother here. So this is our symbol, Orthodox Christian parish nurses, that we have hope, health, and healing. And these icons, this is St. Elizabeth and St. Barbara, which are Russian Orthodox martyrs, and they were nurses. So we use them as our, kind of our blessing. And then we have the Holy On Mercenaries, which are all the saints in the church that have been medical, addressed health in the past. So what we did is I put all 6 of our parishes, and we represent pretty much almost 3,500 people through these 3 churches. But anyway, what we did was we put in each church, so you can access each church, but then you can go into each church, and then you can go into either the healthcare ministry or health and wellness ministry and find out what the parish nurses are doing. So I was going to show you St. Basilios Church, and they have like their pamphlet, and it shows the things that they're doing. And it's on the Ocamper website, too. You can also access it through Parish Nursing and then OPN New England. So, like I said, we have 6 churches that you can access, and it is a work in progress. We basically do like interventions, advocacy, networking, education. We don't really do hands-on nursing that much. If somebody has a critical situation, we'll do CPR, but we don't do dressings or, any really hands-on type of nursing. The last speaker, some of you were here, talked about a community of care, which I thought was a beautiful way to seg into the type of work we do. And we've also been called a ministry of presence, which is just, we can just be there for people. I've had people come and just, want to know how to use a diabetic monitoring kit. And so what we did was, it's pretty simple. It shows it's simple, 1, 2, 3, how to use it. But what happened is that when an older person is given this, it's like, what is this about? So it's time to sit down and share your expertise with the information they need. So we strongly encourage all in every parish to provide this ministry, as it fills a critical need in our health care venues. Every parish has some health care providers or easy access to them to start, for example, blood pressure clinics. We've heard this called a ministry of presence, to be available in a spiritual environment to address needs of body, mind, and spirit, I think is our Lord's calling. So I really encourage you to start parish nursing in your own parishes. And I'm hoping to, by next year, go to the churches in the diocese to start parish nursing as much as possible, because I really believe in it.
Thank you all for coming. I appreciate it. My name is Jackie Tselikis. I'm a registered nurse, and I have a master's as well in education. My background is hospital nursing early on, and then I spent 33 years as a school nurse and a school health coordinator in a large school district where we all come from, Old Orchard Beach, Saco schools in York County, Maine. So my background was working a lot in direct service, but also doing health policy, setting up health education programming, and worrying a lot about employees, parents, children, et cetera, et cetera. So it's a simple change moving into parish nursing for me. That's the type of thing I thought we really needed in our church. We needed a lot of wellness information. We need a lot of education. And we did it similarly to the same way that Elizabeth was talking about. We established a wellness team, and Nancy is a nurse as well. She's on our wellness team. We have a couple of doctors, maybe 3 nurses that are actively involved with us, but most of our people are people in our parish. So we have a very active Philoptico Society. We also have a HEPA in our church, and I work a lot with them doing collaboration on different kinds of programming. So, for instance, February is Heart Month. We'll, do blood pressure checks. We do a celebration for breast cancer awareness. And I'm also a community health nurse, so I do immunizations at church for people and also do them for the Saco Church as well. One of the things that I was mentioning to Elizabeth, and she wanted me to mention to you, Portland has a very large refugee relocation population, and we've been very involved in the community, and this year has been pretty interesting. We've opened up our church to a group of women who are from mainly the African nations relocating into our city, who are in need of ESL, English as a second language. Also learning about the community, how just to be an American, those kinds of things. So we run classes on Saturdays for this particular group. We have maybe 30 to 40 women who bring their children. And my piece in that is I'm developing a health education program for them. So we did a little survey and asked them things they would like to know. And mostly it's about, it's about anatomy and physiology, terminology. We give them vocabulary. We'll do diagrams, et cetera, just very similar as nurses, similar to a health education class that you'd be teaching in, college or a high school. So that's been, very rewarding for us. We work with the different agencies, especially the senior agencies, the Agency on Aging. So we've run many programs. One's called Matter of Balance. Another is Living with Chronic Pain. Another would be learning easy exercises. So my program and the wellness program meets once a month, and we call it Wellness Wednesday. We bring in presenters from mostly the medical community, but we've done things like Tai Chi. We've had people in teaching about nutrition. We've had a lot of things. We do a stress buster. We do movie nights, dinners, et cetera, et cetera. So it's a very inclusive type of program. When I first got there, I noticed, of course, we all have a very aging population. And periodically I was called, just happened to be in church that day, for someone who had either fainted, passed out, or had an insulin reaction or something along those lines. And so I asked the council if we could have an AED, automatic external defibrillator. And they passed that, so we got a defibrillator. We trained the council so that they all have CPR and AED certification, and also opened it up to like the Sunday school teachers. So that's a big service because, of course, as most churches, we run a festival that's huge. The entire city of Portland comes. And so it's very necessary that we have these things in place. So mainly I wanted to say it's a very interesting type of job to do. Of course, we're not paid, so right. But any nurses in a parish that are interested, it's something that they can build as a program, and you use your own strengths and your interests, but you also learn to know your community and you know what kinds of things they need. So it's flux. When something new comes up that we think is necessary for our people to know, or they have a particular interest, it's a program that we would bring into the church. So thank you very much.
Good morning. A few, but the important. My name is Katherine Richo, Katherine Maragudakis Richo, and I'm from St. Philip Church in Nashua, New Hampshire, by way of the cathedral in Boston as a child. That's fine. What I might have to share with you almost sounds verbatim of what Jackie just said, but we each came to it from a different perspective. My background is in critical care nursing for about 34 years, and I did a short stint in hospice nursing. But always nursing, I think each one of us finds our moral compass, always nursing with hopefully discernment and compassion and faith, and yet the cacophony of the critical care setting, even though it, you thrive on it, more and more there was a dissonance and just wasn't able to have time to sit with patients, to be present with them, even though every second counted as a presence in critical care. So just perchance, Father Tom Chininis in St. Philip's said, "Are you interested in going to a conference at St. Anselm College? It's on parish nursing." I had no idea what parish nursing was about. Like most people, I thought it was like a VNA, visiting. It might be that way in some outreach places, but I went and discovered, this is the perfect melding of your passion for your profession and your faith. It was perfect. We were really looking for it. So this was 2009. I didn't know what I was doing. I was in new territory, and I went to a parish nurse program that was offered by Catholic Medical Center in Manchester, New Hampshire, and saw a perfect model. And that helped me try to translate it to Nashua, but you're not able to do that. It just doesn't work. It doesn't even work with each individual Orthodox community. So however it's going to fit into your community, you make it fit. But you need the support of the priest, and that gave it credibility. I mean, I didn't even know where to start. And I said, after all these critical care things I was doing, I said, so we're going to just start with blood pressures? That was enough. That was enough to say there is somebody available. Should you want to come and talk? Do you need health literature? Can I speak? I won't speak for you. I will give you the autonomy to speak for yourself. Do you need a resource? So many other things have evolved. And since then, Father Alex Chetsis has come in. He's been extremely supportive. I have a program that I have parish nurse hours every Wednesday. It just happened to be Wednesday, from 10 to 12. And once a month, I have a therapeutic massage therapist comes in who gives chair massages at a very reasonable fee. She charges less for nonprofits and churches, $10 for 15 minutes, $20 for a half hour. And I have parish nurse hours once a month, the last Sunday of the month after liturgy. And this is confidential. A lot of people say, well, I don't want to tell her she's a member of my congregation. Everything is confidential, and if something is alarming, or you ask permission if you can share it with Father, that's imperative that you establish trust. But we do blood pressure monitoring. Somebody may come in. It's small things, but you realize in today's world, as you both had mentioned, in the changing healthcare system, a lot of people, number one, do not want to go to a doctor, don't have money, don't want to open up a Pandora's box, a variety of reasons. And they see you as a trusting or safe, non-threatening presence. Sometimes it's just for socialization, but oftentimes we've picked up quite a few numbers of people with high blood pressure that really should be addressed. And you do it through education, diet, education, reviewing their medications, or if they're not on med, that you highly encourage them. You can't call the doctor. That's not your role as a parish nurse. You have to encourage them, and they may say, oh, I'll do it when I get home, or whatever their excuse is. But many are prodded to care, to be proactive for their health, and next time you see them. In fact, I was in the middle of doing my cross and kissing the icona, and this fellow came up and said, I went, my blood pressure is, yeah. It's a tricky business. I know there are a lot of minefields out there, but if you walk in and I take your blood pressure and it's 230 over 100, I highly suggest get thee to a physician. But if you walk out and have a stroke, and they'll say, well, why didn't you call the doctor? That's the tricky part. I can't. I can only enable you to call. And that's kind of sort of sits on the edge. When we first started, it was parish nurse ministry, and then we met at the Metropolis with His Eminence, and he really suggested, which I think is better, that we call these health and wellness ministries to be more inclusive, and that's what we have done. As Jackie mentioned, to those in the know, I didn't have the pleasure of meeting you, but I overheard your conversation. You're from Canada. You do have to be a registered nurse. You have to have an active license. You can't have one and then you can be retired, but you have to have an active license. Some individuals do parish nursing and are paid. Others volunteer. And as Jackie said, it's a non-invasive nursing, which was a semi-hard sell for me being in critical care. We don't do things to patients, though some nurses do have cholesterol and blood pressure screenings. They make the patient sign a waiver. But other times, you may have a school of nursing come in with their instructors, and they will do things for your clients. So that's covered that way. I did mention that. I just feel like Elizabeth said, and like this whole conference and our awareness as medical people, is that we're offering presence and listening. We're, in essence, just looking at the whole person. Distress of the human spirit. Why is that person there for you? They walk by to say hello, or maybe I can get some information, or little by little with your assessment skills, something comes out that you never would have discovered had you not gone roundabout and just been present. So in that way, it's good, and it's been helpful to other people. And every now and then you get a little affirmation on the side when you're in church. Not that you need it or want it. What you do is of value in itself, but that made me feel a little good. So suddenly people are recognizing, even if they don't come on a particular Wednesday, they know that there's a parish nurse available. And we too have received, or actually we sought to get an automatic external defibrillator, and we did. That took a little getting. Some people on the board say, oh no, it's a liability issue. Well, how many children have been saved in gyms or on the subway or wherever they're located? Those are meant for the lay public to use. They're self-prompting. But people are afraid. So now, we were worried maybe the kids would play with it. Should we lock it? You don't want to lock it because, God forbid, something happens. Where's the key? I'm not always in church, though I am always on alert for the fainting, and we've gone through that. But nobody has touched it, and we have a lot of people renting our hall. And the minimum, people will say, well, just know where it is. So if somebody says, go get the AED, they know where to run and get it. So it's just teaching people little by little that there's a health, a spirit, body, and mind connection. We all know that. we have several instances, whether it was at St. Philip or with this larger, we belong to a larger, St. Philip does, a larger collaboration, again, consortium with Catholic Medical Center. I know we're at an Orthodox conference, but this, and Father, agreed with, we're under an umbrella of collaboration with no ties of governance or anything with Catholic Medical Center, and there's 18 churches, and now we had a conference a while back, and a Father Gregory Tracus, I think, from Assumption Church up in Manchester is suddenly interested in trying to get a parish nurse to come to his parish. We're one of 18 churches of various denominations. So the person, whether in Manchester or in the community or wherever, can go to any one of us on a particular day and for a particular program. I go up on Thursdays and I do parish nursing at a congregational church. On Wednesdays, I'm at St. Philip. So we kind of make ourselves available to the community. And St. Philip's isn't just for St. Philip's parishioners. It's for the community to walk in if we can avail them. We have had one nurse pick up on a pulse of 30, which the patient promptly was brought to the hospital and really had complete heart block and got a pacemaker. Now, there's a sudden death that could have been, could have occurred. Another individual, which was strange but heartening, was a lovely lady who didn't want to admit it, but used to come frequently and purchase a lidocaine-based tube of pain sop topical. Well, little by little, came to find out, and she had caries and poor dental health. She was putting that on her gums to relieve her pain. And, of course, that impacted on her nutrition, on her socialization, on her comfort, on her quality of life. Plus, she didn't have the money to seek further care. Well, one thing and another, after I inquired about, well, let me inquire of my dentist. Maybe he knows of the pro bono. As it turned out, he ended up seeing her, didn't charge her for a lot of the care. And last time I saw her, she was at a social event with people, eating, smiling. And I thought, gee, that's pretty neat that you could affect somebody's life like that. So parish nursing comes in all different forms. I want to told you about that. Sometimes we have hearing clinics. A local audiologist will come in. This is through the parish nurse program at CMC, or the foot clinics, as I mentioned. But we don't personally do that. If we have flu clinics, we assist. We won't administer. We can, but as a parish nurse, we wouldn't be doing that. We also have chair exercises at St. Philip and a Qigong tape for anybody who wishes to use that. I told you about our clinics. We have a bulletin board, so people are aware of whatever you might post. They want to do fly-by info, just go by and pick a little health information up. Most people are not for sitting for too long. We have, as we all probably do in our church, a monthly bulletin, so Father has given us space. It's gotten real good at editing a brief space for us to have a topic. It could be health, but it's always usually interrelated with spirituality. And that's the other thing that one of the reasons why people come to us. Perhaps they are looking for our sensitivity to our faith, the Orthodox faith, and our culture that maybe they don't find, let's say, with their primary care or wherever else they may go. So that's one benefit of the nurse being in an Orthodox parish. But many people they don't know what a parish nurse does. She isn't a VNA nurse, though some nurses that have parishes way out. My priest has asked me to, can you go visit somebody? I would go as a friend, but I would never go and visit officially without the priests. Okay, usually they want to see the priest because they want to receive communion, but many times they just need to see somebody and somebody from their church. It's very important to them. So I felt good to be able to do that. I told you about that. So again, the benefit of this collaboration is that each church helps each other. We don't eat our young. In nursing, sometimes they do, but in parish nursing, there's such collaboration. You need you call somebody and say, how did you do this? Did you have this problem? And you don't need to reinvent the wheel, and resources are forthcoming. And that's been good. And our collaboration with Catholic Medical Center has been excellent because it's an excellent institution, and we have access to their resources, whereas I might not be able to get a speaker or some other material. Well, now we're able to, and they give freely of their gifts. So I now can say I'm a parish nurse, not just a critical care nurse. And I was delighted to find Elizabeth and Jackie and many other wonderful people who unfortunately weren't able to be here. So thank you for listening.
Welcome to take questions. I wanted to ask one question first.
This little pamphlet here, we just tucked in a lot of little info about parish nursing if you wish to take one, and there's some downstairs.
All for free.
On the table.
We've had Marion Hatches report a couple times here, and she's got material from the city or county. She's in Watertown, I think. They have a lot of blood pressure apparatus. Blood sugar apparatus, cholesterol, several type of things like that. But she services the entire neighborhood, not just the church. I've tried to do that at my church. My county won't do that.
That's it. It doesn't work. See, what Marion does is wonderful, and I'm sorry she's not here because she's. I don't know if this works. Never usually. She has received grants and has accessed. I think she's close to not McLean. What do I want to say? What's the hospital that's right near Watertown? Mount Auburn, and she's gotten a wider spectrum of people she can tap, and that's wonderful, and then we'll all benefit from that. She also, gets grants. I'm not sure whether she has a budget or had a budget, whereas, like in my particular church, I don't really have a budget. I spend a lot of my money, but eventually I will let them know so they'll know what they have to be prepared for. Simple things like I made sure that, and I checked them, I make sure that there's a first aid kit in the altar. Believe it or not, people cut themselves with bandira. In the altar, in the kitchen, and in the nursery, and elsewhere proper. People are either fainting or need salve or need a sugar tablet if they have a diabetic response, and you don't know what it is. So from that point
Are there any other questions for the nurses?
My name is Panayotis Sakilariou, and I'm a graduate of the seminary here. My wife and I recently started a home care agency. And, down there, yep.
Excellent.
And we've been reaching out to the various churches in the area. We've been talking to the priests, and they've been very supportive. And we've already have some clients through a number of churches. And I guess there's a tremendous need. I used to be a hospice chaplain myself prior to this work. So I've seen this need, and I'm seeing it more now of home care or home health care in the home. There's a tremendous need. And I guess my question is, how can we work, because we haven't really spoken with parish nurses yet. Some of the bigger parishes have parish nurses, like Watertown. You mentioned Watertown. But that's something we want to reach out to, is to the nurses, and see how we can collaborate and see what the needs are in the parishes, and see how we can, with our services, come and help. So I guess my question is, how can we best do that?
Are you in Massachusetts primarily?
We're primarily in Massachusetts, yeah, right now.
But an excellent feeder supply.
Right.
That's a good thing to know, because we may know people who have parents who are here. In fact, I downstairs on the table, there's I went to an elder abuse conference that we put together with another organization, and we put a green book down there, and there's a white folder that has resources as far as financial, where to go, like, say, for older people, caregivers, and abuse. It's called the Green Book. It's a green book that's downstairs on the table.
Okay.
But yes, if you're in this area, I'm not sure how we would initially feed into you. But the fact that you exist, it's a perfect.
And I'll read the literature that I just got from you, and I'd love to reach out to you sometime. Maybe you could come and visit your parish, or observe your program, and see how that can work with the parishes that are here. Yeah.
Right. I was going to mention, in Massachusetts, we only have 2 parishes that have parish nurses.
Yeah.
One in Watertown, which is Marion's, and one in Peabody. Right. So those would be, the only contacts that we would have as far as parish nursing. In Maine, we work with, I'm a community health nurse as well, and I work for an agency maybe similar to yours, I'm not sure. Mainly what I do is the York County immunization program, so that's why I'm able to do the immunizations in the churches, because I'm certified to do those through our agency. Those connections are really very necessary and strong. We have home health care. We have 2 agencies in our area, and we also have another agency called Comfort Keepers. And what we've done is we've had them come to one of our wellness meetings, and talk to our, people that are there. And we've also made some connections. So we have a couple of people who are actually working part-time, for the agency. So I think that's excellent. As you say, we really need this kind of collaboration.
Now, have you advertised? Have you advertised or been allowed to bring your literature into the different churches of the metropolis?
Kind of in a soft marketing way. I mean,
yes.
Really, some parishes have put a blurb in their bulletins. We had a display at St. Nectarius' festival, which is in Roslindale.
I think it's important.
Things like that. The priests are very open to it. They see it as a help to what they do. They see it as a collaboration.
Right.
So we're very thankful.
I wish perhaps that you were up close and near Nashua. Just this past 3 weeks, I had a parishioner approach me looking for somebody. She's trying to pre-plan, looking for somebody to come in and help her. She wants an older adult, an older woman, not interested, supposedly, in looking at the available agencies in the area. The fact that, people are swayed if it's somebody of a similar faith, perhaps, the value system of that offering might affect their decision.
It seems to me that's a natural combination. I would work on that, go through the priests, even talk to the bishop. Because there are a lot of parish nurses in the New England area.
There's 6.
6.
Well,
6 churches, yeah.
6 hospitals, 6
churches. Then we have
And the distance aren't that far. I think that's a great opportunity.
I've heard the term silver tsunami. So within like about 5 to 10 years, we're going to have tremendous issues that, like your type of proposal and action, needs to address. And it's just a huge problem. That's why I really believe that, the faith-based nursing is critical at this point, that we really develop it. And one thing, we just recently had a speaker, and I have her paperwork downstairs. I have a little table down there. Well, we have a table that has more information. But she talked about organizing in the individual communities. So there's tremendous amount of organizing through Agency on Aging, through the federal, county, city governments that are working with the elderly in all kinds of ways. I mean, just very simple things that you can't even appreciate, like if a light bulb goes out, who's going to change it? Because if the elder can't get on a stool to change it, Well, there's these agencies that are trying to organize that there are people you can call, that will help or get to it. I just recently heard this woman, I don't want to go to the doctor, I can't drive, I'm just not going to go. Well, they're...
But that's something the parish nurse in each community can organize those things. You should know about programs like that.
But to collaborate,
Yes.
to work together, and not only through our Orthodox communities, but through the wider communities.
But it would seem to me through the diocese itself, the bishop and his priest, they should take the lead in this, to know that this exists, that you exist.
Well, yeah, I have to reach out to them.
So do it.
Right. Well, we're not listed.
Any other questions?
On the website.
Say who you are.
Hi, I'm Nancy Safaris. I'm from Saco, traveling with Jackie. I just had an idea for both of you. Often I think when someone in your parish is ill, okay, you have to take into consideration confidentiality, of course, but I find that other parishioners will come to you and say, what can we do? Someone just got diagnosed with such and such, and it's going to be a long haul. And I was thinking, on your side of the fence, you're already in the home, if it would be okay with the patient, that the parish nurse could be like a target person to say, you know what, somebody needs their dog walked once a day, or a meal brought in twice a week, or, there's parishioners that want to help, but you're like a central place where, again, if the patient is, up for it.
This has happened sort of obliquely the past couple of weeks. I mean, minor stuff, but all of a sudden you're thinking to yourself, well, they might have been able to do that by themselves, but all of a sudden, either because you're getting recognition as an entity in the parish that can help, or people are aware you're there. Somebody said, now we have this walker. Mm-hmm. And it was a Cadillac version. And they didn't want to throw it out. And they said, can you find somebody? And I said, leave it, don't throw it out. Or they'll bring me clothes, or I'll find someplace for it, So in that situation, it's been good. Up in Nashua, they have the AHEPA. Of course, it's open to everybody, but the AHEPA home, the nursing home, is up there. But the Hellenic,
There's one here and there's one in Worcester, too.
In Worcester, too? Yeah. There is.
Yeah, I just think a lot of the education on both ends is that there's a huge community. You don't have to go through this alone, and there's like safe pathways to find resources. Yeah.
I would think also, ladies,
Yes, you.
if you love to us,
doing a parish nurse program? Or?
if you love to us at each work,
Do you have? Oh.
sorry,
I'm in Cleveland.
no one can hear you.
Yes, I'm in Cleveland, so I can share the information with her.
Make sure.
Are you with the Greek diocese?
We have an article about OCA parish nursing.
OCA does have that.
Is it Peter? I'm sorry. Did you
Talk into the microphone, please.
Did you avail yourself of the green book in that folder down there?
No, I haven't.
If there's still some on the table, do take one of each.
Let me ask you ladies also, Every church has a Philopticus. Okay, sorry. They're supposed to anyway.
The women's
Some I know are very active, some may not be so active. But it sounds like this coordination could be something Philopticus. Because it's very easy for the women to say, you know, I'm having trouble at home with this and that. To their Philopticus people, they can come to you. You can go to this gentleman or the priest.
Ping pong.
Should be a lot of things like that going on.
Just like nursing, it goes.
Are there any other questions? I think we're just about the end of our time. Thank you very much, ladies.
Coming and sharing.